We're going to go ahead and do Module 4 now, which is a data strategy. We're going to start by talking about the steps for creating a database design. The first thing that you would want to do is you want to determine what type of information you're going to collect, and you're going to figure the details of what that information is going to look like. The second thing you're going to do is you're going to plan how to collect that data. You need to consider what your timeline would be, how the data would be tracked, and what kind of methods you're going to have, whether it's going to be longitudinal or a one-time frame point, and also maybe who would be collecting the data at the different time points. The third thing you're going to do is you're going to determine your data collection method. You need to go back to that second module and say, am I interviewing? Am I doing surveys and questionnaires? Am I going to do some type of retrospective data entry? You need to kind of identify where the data is coming from and what method you're going to utilize to collect the data. And the fourth thing you do is you actually collect the data. And the fifth thing you do is you analyze the data. And I think that this can be summarized a little bit better in this slide that I have here, which is very hard to see, where the different steps of your design occur. In this particular diagram, the steps go from designing and planning your preliminary data set to pre-testing, into your final survey design and the planning of that, your data collection, and then what you would have to do for your data reduction and your data transformation. So this is a very detailed step-by-step process of what that would look like and how you would do that. I like to give what I call my elephant slide, which is our next little piece here. And this piece is my top tip sheet for breaking down the steps of a database map build, your data map build. So the first tip that I always say is start at the end. This goes back to the top. I'm repeating information here, which is start with your hypothesis. Start at the very, very end. And how are you going to answer that hypothesis? Break it down by going a little bit deeper. Break your hypothesis down into your aims of your study. Create the tables and the templates for what that is going to look like. Identify what variables are required to go into that table of and those figures, and break that down even further. What components do you need to create so that the variables can go into a table? A good example of a variable that would be a broken down variable is perhaps you're looking at BMI. Well, BMI requires you to collect weight and height in order to calculate BMI, which would then you would aggregate that into another piece in order to fill your table in. So you're breaking each of your components down here. After you have figured out what the components will be, you need to identify where you might obtain this information, and you need to be able to assess the integrity of whatever that data collection process is. So if you decide that you're going to take it from an electronic medical record, are you going to put some type of parameters so that it has to be collected within a certain time frame from the date of your other pieces? If you are going to have the information collected in clinic or live, or does the person that's collecting the information, are they trained in a method to collect whatever data that is being collected? If you are collecting BPs, then you want to make sure that the person is qualified to actually do get the blood pressure, something like that. And then after you've broken it all down, now you decide how you're going to collect it and you create your questions. So this is a different way of putting the top 5 at the top. I have here a video of an example data map. this would be very valuable for you to watch. Your homework is going to be creating one of these data maps. And I also have a PDF of the map that I create in the video here. And this is an example of what a data map could look like. Your data map does not have to look like this. It could be a sketch. It could be more detailed than this. It could be less detailed than this. It is completely up to you what you think would help you create your survey later on. The more detail you provide on the front end, the better off you will be on the back end, just as a tip. So I give you a lot of resources at this stage on different ideas and things that you might need to consider when you are designing your data collection. For one thing, you might want to consider what kind of visualization you plan to utilize on the back end, because that's going to help you consider how you want to present the data later on, which will help you figure out what data to collect. So here I have a chart with different ideas for how you might want to collect data and what that could look like on the back end. I have a lot of examples here of different data plans that I have either used or created in the back end. I have a template here for steps of developing a survey. I have a template here for building a structure of a database. These are just ideas for you to kind of think about what you might want to do. And then I give examples of real data forms or data maps of some kind that I have been a part of creating in some way, shape, or form. This first one was a clinic visit that collected food resource information. And in this particular one, the family would enter the clinic, they would be seen for an appointment, at which point different types of appointments were collected, the information of the different types of appointments. And then they wanted to know if a referral happened, and if a referral did happen, what resource was the referral? And if it was a food referral, what kind of food, adult food or baby food in this particular case, and how many people were in the house, and then they had adult questions and child questions. So this is an example of a food resource data map that was turned into a REDCap later on. This next example I have here was a COVID screener that was developed for the health department. In this particular one, this is the pop-up events that they did locally here, and they needed to kind of think through what would the REDCap look like. And so the patient would arrive at the pop-up site in a car. They would stay in the car, and they printed off great big QR codes, and they put them like in the where the person could scan them by the QR with instructions on how to do that. And that got them into their REDCap with a welcome message on what to do and what to expect and the different messages that would occur, and providing consent for the COVID screening. And then they would go straight into their intake forms. These intake forms were proposed so that they could match up with the Ohio Department of Health's forms, and they go straight from REDCap straight into ODERS, which is the Ohio Department of Health database. And that helped alleviate the stress of data transferring and stuff like that. After those questions were collected, they had a confirmation email that was sent to the patient so that they could know how to get their results and how to communicate back with the health department. And at this point, a nurse was sent an email for the nurse to be able to review the chart and make some clinical decisions. And then there was a goodbye notification of some kind. And after all of that, they had um, they had pieces that matched this portion of it, which is the pop-up site with a different project that did the lab queries, so whether the COVID test was positive or negative or undetermined, and you could match the two records together, and staffs were able to fill out all of these pieces. So that's an example of how you might use REDCap in a public health forum. Here I have an example of how you might use a REDCap in a clinical trial workflow. In this particular one, you have a protocol and it goes to different databases. So you might have the person come in and go to a screening database, and the monitor logs the screening database. You could have a training database for the different research staff members, and there's a monitor log for that. You could have a participant database with consent and payment, and a participant database that was de-identified, or you could have these be together. That's a possibility too, but if they are together, you have to have something in your data management plan to remove the identifiers so that your de-identified data can move forward for the FDA submissions and things like that. And inside this, you might end up having your enrollment logs and your monitor logs and all of your electronic source record data. You could have your delegation of authority log database or your eReg database. This is just an example of how one protocol could have multiple sources of information that is being collected in any given moment in time. My next example is an example of a COVID clinical trial that is being used. An example of this would be the Pfizer clinical trial, or the AstraZeneca clinical trial, or the Moderna clinical trial, those, or the J&J clinical trial. All of them fell into this type of workflow. So the patient would come in to do internal registration. They would fill out their visit information, and they would be consented to the study here and become participants. Then the nurse would complete their vaccine documentation, and randomization would occur. Depending on which COVID trial it was, would depend on how randomization occurred and who was doing the randomization. At this point, the physicians would be doing their physician orders and asking for the information that was pertinent in the vaccine documentation history and the medical history. And if they felt like they could move forward and get vaccinated, then you could set it up so that the physician logs the order and scans their badge for double verification, which is required by law for the pharmacy. And the pharmacist would then obtain an alert. In this case, they would get a dose 1 or a dose 2. So in this example, it was much more likely to be a Moderna or a Pfizer example. The pharmacy receives notification of the order and would open it up and fill out their piece, pull the drug. The person that's administering the drug would come in, scan their piece for double verification, and go in and do the blinding and unblinding verification piece and hand it off to the vaccinator, at which point the treatment administration would occur. So those are some different types of examples of what a data map could look like. Now, the next thing that's really important to kind of think about after you have figured out some of these other pieces is what your data management plan might be. So a data management plan is the document that describes what the data is that's going to be acquired or produced during the research, and how you plan to manage the data, how you plan to describe the data, store the data, what kind of standards you will use during your nomenclature and things like that, and how the data is going to be handled for protecting it both during and at the end of the completion of the project. And there are some general rules for creating a good data management plan. These are referenced here in the 10 simple rules for creating a good data management plan. And I have a link here for this article if you would like further information. So in general, these are some 10 really good rules for creating it. Determine the research sponsor requirements. That's number 1. Number 2 would be identify the data to be collected. Number 3 is define how your data will be organized. Number 4 is explain how the data will be documented. Number 5 is describe how your data quality will be assured. Number 6 is present a sound data storage and prevention strategy. Number 7 is define the project's data policies. Number 8 is describe how the data will be disseminated. Number 9 is assign roles and responsibilities. And number 10 is prepare a realistic budget. It sounds like a lot to do, but there are some phenomenal resources that are available with example plans. I like this first additional resource that I have here from usgs.gov. They've got a great tool that I like to use when I'm making a plan from scratch. You can also go down a checklist, which is nice. If you find that you're going to be in a situation where you need to do a data management plan, the UC library also offers a data management plan guide, and they have a workshop, which I recommend going through. So that is the end of Module 4, and we are done with it.